Over 50? Do these 4 exercises to relieve sciatic pain. If you're over 50 and you've ever felt that sharp, burning, or aching pain that starts in your lower back or hip and shoots down your leg, you're not alone. Millions of people over 50 deal with sciatic pain every single day. And the frustrating part is that it can show up out of nowhere. One day you're fine, the next day sitting, standing, or even sleeping becomes uncomfortable. Sciatic pain has a way of slowly creeping into your life. It starts small. Maybe it's just stiffness in the morning. Maybe it's a dull ache when you sit too long. But over time, it can become more intense, more frequent, and harder to ignore. And when that happens, it doesn't just affect your body, it affects your mood, your confidence, and your freedom. Many people over 50 are told the same things over and over again. Just rest. Take pain medication. Avoid movement. Or worse, this is just part of getting older. But here's the truth. While aging changes the body, constant sciatic pain is not something you have to simply accept. The body is designed to move. And when we stop moving, or move less because of fear or pain, certain muscles weaken, others tighten, and pressure builds around the sciatic nerve. That pressure is often what keeps the pain coming back again and again. Now here's the good news. In many cases, gentle, targeted exercises can help reduce that pressure, improve mobility, and calm irritated nerves, especially when they are done consistently and safely. Today, we're going to talk about 4 simple exercises that many people over 50 can do to help relieve sciatic pain. These exercises are not about pushing through pain. They're not about sweating or straining. And they're definitely not about trying to perform like you're 25 again. These movements are about relief, control, and confidence. They're about helping your body feel safer, looser, and more supported. Before we go any further, it's important to say this clearly and honestly. If you have severe pain, numbness that doesn't go away, loss of bladder or bowel control, or pain that keeps getting worse, you should always speak to a healthcare professional first. These exercises are meant for general relief and support, not for diagnosing or treating serious medical conditions. Now, let's begin by understanding why sciatic pain becomes more common after 50. As we age, the discs in our spine naturally lose some of their cushioning. Muscles that once stayed strong with little effort can weaken if we sit more and move less. Hips become tighter. The glutes, which are some of the most important muscles for protecting the lower back, often become inactive. And when that happens, the lower back and sciatic nerve take on more stress than they should. Long periods of sitting make this worse. Sitting shortens the hip flexors, weakens the glutes, and places constant pressure on the lower spine. That pressure can irritate the sciatic nerve, especially if posture is poor or movement is limited. The goal of these exercises is simple. We want to gently open tight areas, activate sleepy muscles, and restore balance around the lower back and hips. When those areas work together again, pressure on the sciatic nerve often decreases. Let's talk about the first exercise. The first exercise focuses on gently releasing tension in the lower back and hips. This area is one of the most common sources of sciatic discomfort, especially after years of sitting, bending, and limited mobility. This movement is slow. It's controlled. And it should never cause sharp pain. As you do this exercise, the key is breathing. Slow breathing tells your nervous system that it's safe to relax. When the nervous system relaxes, muscles often follow. You begin by positioning yourself comfortably, either lying on your back or in a supported position that feels safe for you. The goal is not how far you move, but how relaxed you feel while moving. As you gently bring one knee toward your chest, you may feel a mild stretch in your lower back or hip. That's normal. What you don't want is sharp pain or pulling sensations down the leg. If you feel that, you ease off slightly. Hold the position gently. Breathe slowly. Let your shoulders relax. Let your jaw relax. Many people don't realize how much tension they carry in their face when they are in pain. Then, slowly return to the starting position and switch sides. This simple movement helps reduce tension in the muscles that often press against the sciatic nerve. Over time, it can improve comfort when sitting and standing. Now let's talk about the second exercise. The second exercise is all about waking up the glute muscles. After 50, the glutes often become weak not because of age, but because of inactivity. When the glutes are weak, the lower back works harder than it should. That extra work often leads to irritation around the sciatic nerve. This exercise looks simple, but it's extremely important. As you prepare to do it, the focus is on controlled movement, not speed. You want to feel your hips doing the work, not your lower back. As you gently lift your hips, only go as high as feels comfortable. There is no benefit to forcing height. What matters is that you feel engagement in the muscles at the back of your hips. Hold briefly. Breathe. Then slowly lower back down. Many people rush this movement. Don't. Slowing down increases muscle activation and reduces strain. Over time, strengthening the glutes can dramatically reduce the workload placed on the lower spine. That means less irritation and more support for the sciatic nerve. Now let's move to the third exercise. The third exercise focuses on the hips, specifically external hip mobility. Tight hips are one of the most overlooked causes of sciatic discomfort. When the hips don't move well, the lower back compensates. And when the lower back compensates too often, pain follows. This movement should feel like a gentle opening sensation. Not forcing. Not pushing. As you position your leg, you may notice tightness. That's okay. Tightness doesn't mean damage. It simply means the muscle hasn't been moving through its full range. Again, breathing is key here. Every slow breath helps the muscles let go a little more. If this position feels too intense, you reduce the range. You never force flexibility. Flexibility comes with time, patience, and consistency. This exercise can help reduce deep hip tension that often contributes to sciatic pain, especially pain that feels like it starts in the buttock and travels downward. Now let's talk about the fourth exercise. The fourth exercise focuses on gentle spinal mobility. Many people over 50 move their spine less because they are afraid of pain. But avoiding movement often makes stiffness worse. This movement is about reminding the spine that it's allowed to move safely. As you gently alternate between rounding and extending your back, the goal is comfort, not extremes. You move within a pain-free range. You move slowly. You let the movement feel smooth and controlled. This exercise helps improve circulation around the spine, reduce stiffness, and calm irritated nerves. For many people, this movement brings immediate relief, especially when stiffness has built up from sitting or sleeping. Now here's something very important to understand. These exercises are not a quick fix. Sciatic pain often develops over months or years, and relief usually comes from consistency, not intensity. Doing these exercises once may feel good. Doing them regularly is what creates lasting change. Even 5 to 10 minutes a day can make a difference when done consistently. Another important point, pain does not always mean harm. Especially after 50, the body can become more sensitive. Gentle movement helps retrain the nervous system to feel safe again. If you ever feel soreness after exercising, that's normal. Sharp pain, numbness, or worsening symptoms are not. If that happens, you stop and reassess. Now let's talk about something many people don't realize. Sciatic pain is not always caused by the sciatic nerve itself. Often, it's caused by surrounding muscles that are tight, weak, or imbalanced. That's why stretching alone doesn't always work. Strengthening alone doesn't always work. It's the combination that matters. These 4 exercises work together. 1 releases tension. 1 builds support. 1 improves mobility. 1 restores movement. That balance is what helps reduce irritation over time. You may also notice improvements in posture, balance, and confidence as you continue. Many people over 50 start avoiding movement because they are afraid of pain. But avoiding movement often leads to more stiffness, more weakness, and more discomfort. Safe, gentle exercise is not the enemy. Fear is. Your body is more adaptable than you think. It just needs the right signals. Let's also talk about daily habits, because exercises alone are only part of the picture. If you sit for long periods, try to stand and move every 30 to 45 minutes. Even a short walk or gentle stretch helps. Pay attention to how you sit. Slouching increases pressure on the lower spine. Sitting tall, with feet supported, reduces stress. Sleeping position matters too. Many people find relief by sleeping on their side with a pillow between the knees, or on their back with a pillow under the knees. Hydration matters. Muscles and discs function better when the body is well hydrated. Stress matters. Stress increases muscle tension and nerve sensitivity. Deep breathing, walking, and relaxation can all help. Sciatic pain is rarely caused by just one thing. It's usually a combination of posture, movement habits, muscle imbalance, and tension. The good news is that small changes add up. You don't need to exercise for hours. You don't need expensive equipment. You don't need to push through pain. What you need is consistency, patience, and trust in your body's ability to adapt. If you're over 50 and dealing with sciatic pain, remember this: your body is not broken. It's responding to years of patterns. And patterns can change. Start slow. Stay consistent. Listen to your body. Some days will feel better than others. That's normal. Progress is not linear. What matters is that you keep showing up for yourself. You deserve to move with less pain. You deserve to feel confident in your body again. And you deserve solutions that respect where you are right now. These 4 exercises are a starting point, a foundation. Over time, as your strength and mobility improve, your comfort can improve too. And finally, always remember, pain is information, not a life sentence. Your body is capable of healing, adapting, and improving, even after 50. Take it one day at a time. Keep moving gently. And give your body the care it deserves.